Welcome to section 9 of reproductive embryology. In this section, we'll be discussing the third, fourth, and sixth pharyngeal arches and their derivatives. Let's get started. I introduced this table in the last video, and here it is again for your review. You can see that there are arches 1, 2, 3, 4, and 6, and that each arch has associated cartilages, muscles, nerves, and arteries. Again, I'm not going to read this to you, but it's here for your review. And in this video, we're going to focus on the final three arches. So third, fourth, and sixth right here. Just like with the last video, this scene will also take place near the Arches National Park. Notice that off to the left of the image, we've included a cabin with a couch that has some head cushions shaped like the number 3. This is here to help you remember the third pharyngeal arch. All the information off to the left by this cabin will be about the third pharyngeal arch. Towards the middle of the image, we've added a 4-square play area. The 4-square is here to help you think of the number 4. So this part of the image will be all about the fourth pharyngeal arch. Finally, off to the right, we've added some adults sitting on the dirt and enjoying a few 6-packs. The 6-pack should make you think of the number 6 and is here to help you remember that this part of the image is all about the sixth pharyngeal arch. Hopefully with the way we've compartmentalized this information, it'll make it easier to recall the details. All right, now that we've laid out the framework for the image, let's discuss the third pharyngeal arch in more detail. In the last video, we showed a very small kid with a French horn who was waving and saying hi, and this represented the lesser horn of the hyoid. In this video, we'll use a similar symbol, but notice that this kid is pretty chubby. So he represents the greater horn of the hyoid. So chubby kid waving as if saying hi, and French horn for greater horn of the hyoid. As the story progresses, you'll eventually see who this friendly chubby kid is waving at. Now we've added the kid's dad to the scene. If we zoom up, you can see that his dad is enjoying some food and swallowing some pretty big bites. Looks like he must have swallowed a chicken drum whole, and we can see the bone in his throat, which is sticking out pretty prominently. This reference to swallowing should help you remember that the third pharyngeal arch is associated with the muscle and nerve associated with swallowing. Zooming out a bit more, you can see that we've added a forensic guy along with his canine dog to the scene. There must have been some suspicious activity taking place in these parts, so there appears to be an ongoing investigation. The dad and kid don't seem to care too much though, just sitting back and enjoying the couch. Anyway, the word forensic sounds kind of like pharyngeus in the word stylopharyngeus. So this is here to help you remember the stylopharyngeus muscle. The 9 in canine should make you think of the 9th cranial nerve, which is the glossopharyngeal nerve. So remember, the third pharyngeal arch is associated with the muscle and nerve related to swallowing, including the stylopharyngeus muscle and the glossopharyngeal nerve. All right, if we zoom out a bit more, now we can see why there is an ongoing investigation. Someone died right on the porch. We can see a forensic guy palpating the unfortunate soul's carotid artery to see if he has a pulse, but it appears to be hopeless. This reference to the carotid arteries should help you remember that the third pharyngeal arch gives rise to the common carotid artery and proximal part of the internal carotid artery. The last thing you need to know about the third pharyngeal arch is that it forms the posterior 1/3 of the tongue. However, the third pharyngeal arch isn't the only contributor. The fourth arch also contributes. So notice that we've placed the symbol for this concept right in between the cabin on the left and the 4-square area in the middle. So this dog and the forensics guy right here. If we zoom up a bit, you can see that the forensics guy is holding the front part of the dog's tongue with his hand, which effectively obscures it from our view. Now we can only see the posterior aspect of the dog's tongue. This is allowing him to adequately swab the back of the dog's mouth. I guess they want to be sure that the dog isn't responsible for the death, right? Anyway, putting all of these ideas together should help you remember that the third and fourth pharyngeal arches form the posterior 1/3 of the tongue. All right, so far we've covered all the information about the third pharyngeal arch. Now let's transition and discuss the fourth pharyngeal arch. Again, the information near the 4-square area represents the fourth pharyngeal arch. As you can see, we've added a bully to the image. He lost the game of 4-square and is a sore loser, so now he's trying to strangle his opponent near the 4-square area. Luckily, a parent is supervising these rambunctious hooligans and is stopping the bully. Anyway, the bully squeezing the other kid's throat is here to help you think of pharyngeal constriction. So the fourth pharyngeal arch forms most of the pharyngeal constrictor muscles. The poor kid getting strangled is pretty traumatized, and we can see him bawling his eyes out. The word cry sounds like crico, and the fact that his neck is being strangled should make you think of the word thyroid, because this is where the thyroid gland sits, right? Anyways, putting these two ideas together should help you remember that the fourth pharyngeal arch forms the cricothyroid muscle. Finally, the parent is lifting up this bully by his shirt, causing it to cover his head. This kind of resembles a veil, and should make you think of the word veli. The fact that he's getting elevated into the air by the parent should make you think of levator. So putting these ideas together should help you remember that the fourth pharyngeal arch forms the levator veli palatini muscle. All right, now we've added two more components to the image. First, notice the guy off to the right here. He was apparently hired by these adults as a form of entertainment. He brought a record player and is playing some nice tunes for them. His business is known as Vegas Records, and he brought some shirts that say Vegas on them to try and sell to the adults. Now take a look near the foursquare area. Notice that we've shown a kid getting suspended in the air by his friend. They stole one of the DJ's shirts and are running around showing all of their friends. In any case, the word Vegas should make you think of the vagus nerve. Also, the reference to the kid being high up in the air should make you think of the word superior. So putting these two ideas together should help you remember that the fourth pharyngeal arch is associated with the superior laryngeal branch of the vagus nerve. Now let's discuss the vasculature associated with the fourth pharyngeal arch. You can see that now we've shown a tree growing behind the foursquare area. If you look closely, you can see that it resembles the aortic arch. We've also intentionally placed it a bit off to the left to make you think of the left aspect of the fourth pharyngeal arch. So putting these ideas together should help you remember that the left aspect of the fourth pharyngeal arch forms the aortic arch. The right aspect, on the other hand, forms the proximal part of the right subclavian artery. To help you remember this, we've shown a kid off to the right of the tree eating a sub sandwich. So sub for subclavian artery. Also notice that we've shown his friend trying to hand him some red licorice, which kind of resembles blood vessels. This is here to help reinforce the idea that we're dealing with the vasculature associated with the fourth arch. Okay, we've covered all of the muscles, nerves, and arteries of the fourth pharyngeal arch. Now let's discuss the cartilage. Notice that these are shared between the fourth and sixth arches. Just like how the dog was between the area that represents the third arch and the fourth arch, right here, notice that we've included several more elements to the scene, and they are directly between the foursquare area and the adults with their six-packs, right here. So all of this information will be about both the fourth and sixth pharyngeal arches. Let's zoom up on this so you can see it better. First, notice that one of the kids was trying to play foursquare when his ball accidentally landed on a nearby kid who was enjoying a bowl of cornflakes. The ball knocked over the bowl and then bounced back and hit him right in the neck. The cornflakes are here to help you remember the corniculate cartilage. He was pretty excited to eat the cornflakes, and now that they have spilled all over his lap, he's pretty upset. Look at those tears. Anyways, the crying is here to help you remember the cricoid cartilage. Don't get this confused with the other kid right here who's crying. Remember, he was being strangled and simultaneously crying. The reference to the neck plus crying with this kid was here to help you think of cry and thyroid, so cricothyroid. On the other hand, this kid crying without his throat being strangled should just make you think of the cricoid cartilage. So the fourth and sixth pharyngeal arches form the cricoid cartilage. Next, notice that the ball is hitting the other kid directly in the throat where the thyroid gland is. This is to help you remember the thyroid cartilage. A bit below this tragic scene, we can see another bully terrorizing an innocent kid that's minding his own business and trying to study. We can see the bully mindlessly ripping up his homework. The word rip sounds like arytenoid, and is here to help you remember that the fourth and sixth pharyngeal arches form the arytenoid cartilages. Finally, the Q&A quiz that the other kid is working on sounds kind of like cuneiform. Q&A, cuneiform. So the fourth and sixth arches also form the cuneiform cartilage. All right, that's all for the fourth pharyngeal arch. Let's finish up by discussing the remaining portions of the sixth pharyngeal arch. As you can see, now we've added some speaking pop-up bubbles around these adults. After all, they're having a pretty good time listening to music, drinking their six-packs, and talking to each other. Seems kind of like social hour for them. Anyway, these speaking pop-up bubbles and the reference to social hour should help you remember that the muscles and nerve associated with the sixth pharyngeal arch assist with speaking. We introduced the DJ guy earlier with his record player, and the word record should make you think of recurrent. This, along with the vagus reference, should help you remember the recurrent laryngeal nerve, which is a branch of the vagus nerve. Now we've added a guy who's enjoying the conversations and simultaneously feeding some wild ducks licorice. Just like before, the licorice is a reference to the vasculature. This, along with the ducts, should make you think of the ductus arteriosus. So the sixth pharyngeal arch gives rise to the ductus arteriosus. Now we've added a fourth guy to the scene who was also enjoying some licorice until he noticed some wild bobcats coming out of their lair directly towards them. Now we can see him coughing up his licorice in terror and pointing towards the bobcats in an attempt to warn his friends. Rightfully so, because remember the forensic investigation from earlier? Well, I think we just found the culprit to this murder. You guessed it, the bobcats are responsible. Anyway, the cough should make you think of the lungs, and the licorice should make you think of the lung vasculature. So putting these two ideas together should help you remember that the sixth pharyngeal arch gives rise to the proximal part of the pulmonary arteries. The bobcat's lair is here to help you think of the word larynx. And remember that the sixth arch forms all of the intrinsic muscles of the larynx except the cricothyroid, which is derived from the fourth pharyngeal arch like we discussed earlier. All right, now that we've covered all of the information, let's review with a question. A medical student is being tested on the cranial nerves in a gross anatomy laboratory. A nerve is pinned that is associated with taste and sensation of the posterior one-third of the tongue. The pharyngeal arch associated with this nerve gives rise to which of the following structures? A. Stylohyoid muscle, B. Mylohyoid muscle, C. Levator veli palatini muscle, or D. Stylopharyngeus muscle. Okay, hopefully from the question stem you notice that the cranial nerve being described is the glossopharyngeal nerve, or cranial nerve 9. We can deduce this because only the glossopharyngeal nerve is associated with taste and sensation of the posterior 1/3 of the tongue. The 9th cranial nerve is also associated with the 3rd pharyngeal arch, which gives rise to the stylopharyngeus muscle. So choice D is the correct answer. From the image, recall that the forensics guy right here is here to help you remember the stylopharyngeus muscle. The K9 dog right here should make you think of cranial nerve 9, and the 3 on the couch right here should make you think of the 3rd pharyngeal arch. From the overview table, we can see the same information. The 3rd pharyngeal arch gives rise to the stylopharyngeus muscle and is also associated with cranial nerve 9. You may have noticed that both the 3rd and 4th pharyngeal arches form the posterior 1/3 of the tongue, but this is referring to the muscles, as you can see in this column. However, only the 3rd arch is associated with the glossopharyngeal nerve. You can see that the 4th arch is associated with the superior laryngeal branch of the vagus nerve. Therefore, we can deduce that the question is not referring to the 4th pharyngeal arch, it's referring to the 3rd pharyngeal arch. A is incorrect because this develops from the 2nd pharyngeal arch. B is incorrect because this develops from the 1st pharyngeal arch. Finally, C is incorrect because this develops from the 4th pharyngeal arch. So again, the correct answer is D, the stylopharyngeus muscle. And with that, we've covered everything you need to know about the 3rd, 4th, and 6th pharyngeal arches.